What future conditions might beta-3 agonists treat? Imagine a medication that could help improve bladder health and maybe even do more in the future. Beta-3 adrenergic receptor agonists are a class of drugs that are already making a difference in treating certain bladder problems. They are mainly used to help people with overactive bladder, which causes sudden urges to urinate and frequent trips to the bathroom. These drugs relax the bladder muscle, called the Detrusor, making it easier to hold urine and reducing symptoms. They are also approved for use in people with neurogenic Detrusor overactivity, which can happen in conditions like spinal cord injuries or multiple sclerosis. In addition, men who are being treated for benign prostatic hyperplasia often find relief from bladder symptoms when using beta-3 agonists. Looking ahead, researchers are exploring how these drugs might help with other bladder issues. For example, studies suggest that beta-3 agonists could improve bladder function in different types of bladder dysfunction, whether caused by nerve problems or other factors. Their ability to influence bladder muscle tone and improve bladder compliance could make them useful for conditions involving trouble storing urine or emptying the bladder properly. Combining beta-3 agonists with other medications like antimuscarinics is also being looked at as a way to boost treatment effectiveness for bladder symptoms. Beyond bladder health, scientists are investigating how beta-3 receptors might play a role in cancer biology. Some studies have shown that beta-3 adrenergic signaling could affect tumor growth and the immune environment around tumors. However, the effects seem to depend on the type of cancer and where it is in the body. Interestingly, some research has found a possible link between the use of beta-3 agonists and an increased risk of kidney cancer in patients treated for overactive bladder. Because of this, doctors are cautious and recommend careful patient monitoring. It's important to remember that the potential for beta-3 agonists to either promote or inhibit tumor growth is still being studied, and their role in cancer prevention or treatment remains uncertain. While these drugs are generally safe and well tolerated when used for bladder conditions, the possible link to cancer risk highlights the need for ongoing research. Healthcare providers carefully weigh the benefits and risks for each patient, especially those with a history of cancer or other health concerns. As science advances, future treatments might expand to include a broader range of bladder problems or even influence tumor behavior, but these applications are still in the experimental stage. For now, it's best to consult with a healthcare professional to understand the current uses and potential future developments of beta-3 agonists. They can provide personalized advice based on individual health needs and the latest scientific evidence.